I was coming in part out of curiosity because I wanted to compare philosophies from my background, which is the medical model. I knew there was a real difference in theology and understanding of the body work. I had been asked if I would be a model because I had many scars, and the area she worked on was my low back, where in 1980 I had back surgery. So since that, I had basically real numb area in that area as well as some over the hip. But I also had some very sensitive area over the hip at the same time. Due to that and additional wear and tear on the segments above, I have had continued discomfort, for which I've seen a physician who deals with pain only in his practice, and have received probably about 4 injections to the spine to deal with the pain. With that, he's also given me pain patches to wear, and I've been wearing those every night for the last 3 years. And that is in addition to some pain medication that I also have. Sharon worked on me on the 8th. I have not taken pain medication but once since then, and we're now on February 18th. Nor have I worn any patches since then. And I'm able to get up out of bed in the morning without even thinking about pain or how I should move to get up out of bed. I've also noticed that I'm having less discomfort through my entire back, even upper shoulders and neck, because I don't have the tightness and the guarding that I was experiencing prior to this. After taking the class, I think the physical therapy and medical model and the scar release and the information that Sharon's trying to present is very similar. And I think the only difference maybe is semantical and possibly the technique. I know from my experience in physical therapy and myofascial release, it was much more aggressive, and her approach is much lighter touch. In comparison of results, I would say Sharon gets probably at least 80% more results in a treatment session than what I got when I was treating patients. That's in one session. And I think physical therapy, who are very strong and set in their ways and feel that they have the only means of treating a patient, I think they would be surprised on how much better they could treat patients if they could open their minds and go across that invisible line and work with some of the other disciplines. I'd recommend it to, especially the burn people that are specializing in burn patients, as well as others that are dealing with post-surgical people of any type. Yeah, I would encourage people to go to the courses.